Suturing practice, continuous suturing. Items required: suturing practice block, needle holders, tissue pickups, pointed curved scissors, sutures for practicing mare silk. Go through the looser flap first into the tighter flap here. This simulates going from a buckle flap in the upper jaw to the palatal side. Go through at right angles, taking hold of the needle with the tissue pickups, picking up the needle 1/3 from the swaged end at right angles. Then pick up the firmer flap, go over, using the reverse grip, winding on, pulling the knot down onto the tissue, tightening the knot, keeping the knot away from the incision line, then going under once, winding on, pulling the knot tight, going over once, pulling it tight, and then presenting one knot, one of the threads to be cut, and ensure that the other one is not cut. Then prepare a needle in the needle holders. Go to pick up the flap. Go through and out the other side. Then pick up the flap, Go in the tissue, and go through both flaps at the same time here because they're close to each other. Take the needle and pull it through the loop and then pull tight. Pull the needle in the needle holders again, turning it round because we're coming the other way. Then pull the locking continuous suture tight. And put our finger through like that so we're holding the thread. Pick up the tissue. Going into the tissue, out through the other side as well, pushing the needle through a little bit, keeping the other end of the thread tight all the time. Then pass that through and let go with the little finger. Take hold of the needle, pull this tight, prepare the needle for the next bite. Then take hold of the thread between the third and fourth fingers. Pick up the tissue. Then go through the loop. Let go of the thread with the little finger, take this through and tighten it, prepare the needle again. Then put the thread through the little finger and third finger. Now we're going to be tying the knot. Put the tissue pickups in the loop there. Pulling the whole suture tight. Transfer that to the right hand. Park the tissue pickups. Go over, over, and then we go into the loop. Go in and lift gently. Pull with the other hand. That gets to the top of this loop. Then pull it through and tighten the knot. Then go under once and go in and lift, grip, turn round. Now, if you pick that up there and pull it through, it hasn't gone through all the way, so you must then pull on one of these ends of the loop to pull that through tight. Lift, close and pull tight. Then present the suture to be cut.